Hi, my name is Sarah, and today I'm going to be a student nurse performing a postpartum assessment and providing discharge instructions for a new mom. So before entering, I'll gather my supplies, and then I'll be checking hospital policy, patient past medical history, patient's vital signs, trends, and when their last meds were taken to make sure, if in case they did want anything when I visit them, and any known allergies. So I have a 17-year-old. Her name is Ann Jones, G1P1, 39 weeks, who delivered last night at 8:30 p.m. So now let's go in her room and say hi and do her bubble assessment. Knock, knock.
Come in.
Hi, my name is Sarah. So I'm going to perform hand hygiene, close the curtain, maintain patient confidentiality, and I'm going to check your ID. So can I have your name and last name?
Ann Jones.
Okay, and I'm just going to check your armband, and I'm going to check her MRN number to make sure that I have the right patient.
And my birthday is January 2nd.
And thank you for telling me your birthday.
January
Name and
2nd,
birthday.
2002.
Okay, perfect. And everything matches up, so we have the correct patient. So now, is it okay if I do a postpartum assessment on you?
Yes.
Just want to check that everyth's okay down there. And congratulations on your baby.
Thank you.
Of course, do you mind if I take him? Thank you. He's so cute.
He is.
Okay, so as a nurse, it's always important to first just assess her general demeanor. If she's in any respiratory distress, you'd immediately let the healthcare provider know. But so you'd want to just assess how she's feeling, if she's still lethargic, or if she's even feeling a little off, if she's sad or having any postpartum blues, like you'd want to ask her about it. So, Ann, how are you feeling right now?
Okay, a little tired.
Okay. Are you feeling any signs of sadness, depression?
No.
Okay, so within the first 10 days, sometimes people get postpartum blues. So they'll tend to cry randomly, be really moody, and that's just due to hormonal changes and having a baby. So that's normal. But what's not normal? Where you should go to a healthcare provider is when you get postpartum depression, which is anything after 10 days. And Mom, this is for you too, so you can know and just look out for her. So after 10 days, you'd want to maybe contact a healthcare provider if you are feeling depressed or just stressed out, and that's normal. That's okay.
Okay.
But another problem that patients may face is they may feel postpartum psychosis, and this is more common in patients who have bipolar, who have history of bipolar. Do you have a history of bipolar?
No, and not in my family either.
Okay, perfect. Thank you. So, after asking her about psychosocial questions, I'm gonna move on to asking her if I could do my assessment on her. Is it okay if I do my assessment? It'll be a little up close and personal.
Yes.
Okay, sounds good. Thank you. So, I will begin my assessment with the breasts, which is what B means for in bubble. So, you could start asking the mom, how do your breasts feel?
A little sore.
Okay. So, soreness is really common, and they may even feel heavy. So, you can, I'm going to assess the areolar, if there's any bleeding, skin breakdowns, fullness of the breast, bruising and sucking marks, as well as cracks and bleeding, which is sort of common for moms. But if your breasts have marks on them, or it shows signs that it may show signs that the baby is not latching on correctly. So next time you do breastfeed, is it okay if you just let me know, and I'm just going to see how the baby's doing?
I'll let you know, absolutely.
Okay, perfect. And also, if you have any redness, pain in just one of them or both of them, if it's just warm to touch, that may be signs of an infection called mastitis. So you also let me know and call your healthcare provider if you do have any of those signs and symptoms, okay?
Okay.
Great. So it's important to teach mom what to look for with their breasts and what's normal and abnormal, and some interventions that may help them. So I heard that you are breastfeeding, so you could also apply just warm compacts and warm packs to help with that pain, and also just take Tylenol if that does help.
Okay.
But when you do stop breastfeeding, you could also take cold showers, and you could put lettuce wraps on your boobs to help with just to help with the pain, really.
Okay.
Yeah. So next is going to be the uterus. So for this procedure, I'm going to have you lay flat on your back. Is that okay?
Yes.
Okay. So with your left hand, you could find you could find the bottom of the uterus, and you do this with like proper body mechanics. Obviously, my bed doesn't lift up and down. So you'd use the left hand to find the bottom, and you'd use your other hand to find the top of you could use either hand. And she's almost a day after giving birth, so her fundus will be probably below or at the belly button. So you could just feel where you think it'd be. And if it's to the right or left, you'd want to ask her, have you gone pee yet?
Yes.
Okay, so that's fine. But if it is to the right or left, it's probably because they have a full bladder, so they'll probably need to go pee. And then also, a normal finding is a firm fundus, so it feels like a tennis ball. But if it's not firm and like soft, you have to give it a good massage, or maybe even let the doctor know, so he could administer some Pitocin or something so that she doesn't get any postpartum hemorrhages. And as you massage, you want to assess for any clots that expel from the vagina as well. So next, I'm going to ask you about your bladder and your bowels. That's
okay.
what the B stands for in bubble. So when was your last bowel movement?
A long time ago.
Okay, so anything more than 4 days, you'd want to let us know, so maybe we could give you some stool softeners to help you go number 2. Is it okay?
That we should get that.
Okay.
Going.
Yeah, probably because you haven't, you just had maybe epidural or any type of pain meds that will decrease your bowel function.
Well, it was worth it.
Yeah, definitely worth it. So after asking her when her last bowel was, she most likely will say she is constipated, so you could tell patients to increase their fluids. Make sure you drink a lot of water and eat a lot of fiber after you get discharged, just to help everything get going, and ambulation will also help as well. Patients may also experience hemorrhoids during their during the birthing process, so you could always give them some type of ointment which helps decrease the hemorrhoids and the size of it. I will also ask her when her last time she went pee was.
Not too long ago.
Okay, perfect. So it's good that she's already peeing. She was a vaginal birth, so she had no Foley catheter involved. All right, so after that, the L in bubble means lochia. So I will assess her pad for rubra lochia since she's day 2. But rubra lochia is typically up to 3 to 10 days, and up to 3 days. And that's like this really like red bleeding, but you don't want too much of it. So can I see your pad?
Sure.
Oh, thank you. So her pad, fortunately, looks good. And how long ago was this?
A day. A couple hours.
Oh, an hour ago? Okay,
yeah,
it looks perfect.
Ago.
It's not too saturated, but if it is within 15 minutes and saturated, that may be a sign of postpartum hemorrhage. So it's always important as a nursing student to always weigh these pads. So you put it on the weigh, and you'd see how many milliliters or how many grams she lost in blood. But you'd always want to ask her and assess the lochia. So 10 days, from 3 to 10 days, the lochia or the discharge will look brown and reddish pink, which means it's just the leftover blood. And then within 10 days to 6 weeks, the lochia will be, it's going to be more of a yellowish color. But if you get discharged and you still see really heavy red bleeding, you should definitely let us know.
Okay.
Since you did have an episiotomy as well. Thank you. So we're just going to assess for the lochia if it's scant, light, moderate, or heavy lochia. But other than that, everything looks great for her. Just give me a turn over. I'm going to check under your butt.
Okay.
Okay, good. Okay. So it's important to check under their bottoms in case that they have pooling of blood, which could also be a sign of postpartum hemorrhage. But while I'm assessing, I can also assess under there, in her perineal area. I can also assess for her episiotomy that she just had, any lacerations, hemorrhoids, and I will note that. And I will put in the chart redness, edema, ecchymosis, discharge, drainage, and approximation of the episiotomy or the laceration. But she had a midline episiotomy and everything looks clean and it doesn't have any signs of infection from when I just saw it. So lastly, the L in a bubble also means legs. So I'm going to check the Homan sign and see if she has thrombosis. Her legs will be red, sore. So could I just take a look at your legs?
Oh, yes.
Okay. So everything doesn't look red or sore, but if it does look red and tender, one of them, it could be a sign of a deep vein thrombosis, which is due to just giving birth. Your clotting factors have increased due to stopping the bleeding. So therefore you could end up with DVTs, which could go all the way up to your lungs and cause a pulmonary embolism, which means like there's a clot in your lungs. So it's going to be really hard to breathe. You're going to feel shortness of breath. So if you ever feel that after going home, you need to go to the emergency right away. And I'm just going to feel for the pulses down here by her legs, the posterior tibialis and the dorsalis pedis pulse, and making sure that they're strong and equal and has a good rhythm, which it does, which means there's good circulation within her body. Okay, thank you. So now that I've assessed her legs and for DVT, I'm going to do discharge teaching. So you can sit up or you can lay down, whatever's comfortable for you.
Okay, thank you.
Of course. So here's a pamphlet for discharge teaching that I've created for you. Yeah, so that has everything you need to know.
Thank you.
Yeah. So in there, you're going to see things about when to report to a healthcare provider. So you'd want to report to a healthcare provider when you have, like I said, clots in your legs, when you're excessively bleeding, and when there's tenderness in your breast that can indicate an infection, when you do have a temp of more than 100.3, and also your uterus will be getting smaller at this time. So that's called involution, but subinvolution may occur as well. But that's when you need to let somebody know if you still continue to bleed.
Okay.
But other than that, your bowels, you will have a hard time pooping. You're going to feel a little constipated. So you're going to need to take a lot of well, not a lot, but just take some fiber on top of your iron pills, because iron does also cause constipation.
Oh.
And you're going to also, I forgot what I was going to say. Oh yeah, you're going to eat a bunch of variety of foods as well.
Okay.
Yeah, for your constipation. And then make sure you get lots of rest, heal, give yourself that space and that time with your baby to bond. And also, if you do feel any signs of suicide, any signs of like not feeling well, just try to go to a doctor, get some help. Maybe they could give you some medicine to help, because postpartum depression is common. And that's for the family as well. Just look out for signs. Oh, maybe in a few weeks, if she is feeling a little like sad, that's known as postpartum depression. So I'm also going to teach some newborn care for your little baby. Here's her little baby. So you're just going to assess for any signs of increased respiratory rate. Their rate is usually, if anything is more than 60 respiratory rates, then you need to go to a healthcare provider, because it could mean that their blood sugar is low. Maybe you're not feeding him enough, or just maybe because you were gestational diabetes. I'm not sure. But also, if he has a fever more than 37.5 degrees Celsius, you'd want to let the provider know. If he's cold, has a low temperature, if he has jaundice all of a sudden within a few weeks, you'd want to let the healthcare provider know. If he's just all of a sudden fatigue, not feeding well, if he is grunting while he's feeding, like making those noises when he's feeding, that means that he may have a heart defect. Or it just means he's enjoying his milk. But just be aware of how he's breathing, and if his nose is like nasal flaring, like opening up, that may be a sign that he's having a hard time breathing.
Mm-hmm.
Yeah. But make sure he has at least 6 wet diapers, and just continually feed him when he wants to be fed by mom, okay? And also if he has any excessive diarrhea or constipation, just let your doctor know right away.
Okay.
Yeah. Vomiting too much is not good, but they will vomit here and there, but too much, they're gonna have fluid electrolyte imbalances, and he's gonna need some fluids.
Okay.
But other than that, I just wanted to say congratulations on your baby.
Thank you.
Of course. I hope you have a wonderful time at home, and just let us know. Use this pamphlet if you ever need anything, and don't ever be afraid to call your doctor.
Thank you.
You're welcome. Here you go.
Sarah, you've been wonderful.
Oh, thank you. I will maintain patient privacy. I will open up the curtain again, give her her call bell, and wash my hands after this procedure, and I will head out. But thank you for watching my video. Bye!